All right, the last few slides in this chapter are going to be dedicated to a splenectomy, and a splenectomy is surgical removal of the spleen. So, as I mentioned in previous lectures, the spleen may be, you know, the spleen is responsible for housing red blood cells and platelets. And so the spleen may be removed to reduce the rate of red blood cells and platelet destruction, or to sometimes stage your Hodgkin's disease. It can be done as an emergency procedure to stop hemorrhage after traumatic splenic rupture. It's also the treatment of choice for diseases like ITP, for example, like chronic ITP, or patients who don't respond to steroids. Besides bleeding and infection, splenectomy can cause other complications like pneumonia and atelectasis. So we want to keep in mind the spleen's location. Let me get to here. It's close to the diaphragm, okay? So you want to make sure that we talk about where that incision is going to be. It's going to restrict lung expansion after surgery. So other things that you want to make sure that we teach them preoperatively is that essential coughing and deep breathing. Those are all very big things that we're going to talk about. So patient preparation, for example, you want to explain to the patient that a splenectomy is going to involve removal of the spleen under general anesthesia. You want to inform them that the patient can lead a normal life without their spleen, although they are more prone to infections. So that's a big thing that we teach them about. We're going to obtain results for blood studies, including coagulation tests and a CBC. Okay, so those are going to be your baseline labs. Sometimes we will have to transfuse blood to correct anemia or hemorrhage. Similarly, you're going to give vitamin K to correct clotting factor deficiencies. And a lot of times we're going to give a pneumonia vaccine preoperatively. You want to take the patient's vital signs and perform a baseline respiratory assessment. So you want to note any signs and symptoms of respiratory tract infections like fever, chills, any crackles, any cough. And you want to notify the doctor if you suspect an infection because that may delay the surgery. And as I mentioned already, we're going to teach the patient coughing and deep breathing techniques to help prevent postoperative pulmonary complications. During the early post-op period, you want to check the patient pretty closely, especially if the patient has a bleeding disorder, for bleeding from the wound or drain and signs of any internal bleeding, so like bloody urine or bloody feces, for example. You want to make sure that, we watch our lab studies, particularly for an increased white blood cell count or an increased platelet count following a splenectomy, and know that it can persist for many years. So because an elevated platelet count may dispose the patient to risk for clots, you want to help them exercise and walk as soon as possible after surgery. We want to encourage our patient to perform coughing and deep breathing exercises to reduce the risk of pulmonary complications. And we're going to watch for signs and symptoms of infections such as fever, sore throat. We're going to monitor the results of our hematologic studies. And if an infection does develop, we want to make sure we give an antibiotic as prescribed. We make sure that we give narcotics for pain specifically because of where that incision site is. So we want to make sure the patient has adequate pain relief so that they can cough and deep breathe so that we don't get early onset pneumonia. So some of the complications, you want to inform the patient that they are high risk for infection. So we want to make sure that we teach our patients signs and symptoms of infection promptly. We want to teach them measures to prevent infection. So that could include getting the pneumococcal vaccine. We talked to them about getting their flu vaccine. Those are all things that we teach the patient post-operatively. And then of course, the high risk for surgeries, complications, bleeding, pneumonia, atelectasis. But another thing that's specific to the spleen is you have an overwhelming post-splenectomy infection that can occur. The crazy thing with this is the patient can get this like years later, okay? So when a patient doesn't have a spleen, even though, we teach them they can lead a relatively normal life, we still need to teach them that they can get an infection without it. So it is important that we make sure the patients understand that they can still get an infection years later, okay? But that's it. That's all I want to talk about on the spleen.